My name is Richard Lamour. I am a board-certified dual fellowship-trained orthopedic surgeon in sports medicine and foot and ankle orthopedics. My practice focuses on the lower extremity, primarily the knee, ankle, and foot. First, I'd like to thank you for trusting me and our team here at Olympia Orthopedics with your care. We are looking forward to resolving your pain and restoring your function so you can get back to playing your sports, returning to your job, or just getting back to the hobbies and recreational activities that you love to do. In preparation for your surgery, you will have some limitations in your weight bearing for a period of time, depending on your procedure. So there will be equipment needed after surgery to help maintain the weight bearing restrictions or to offload the operative site from being overloaded. Crutches, walkers, knee scooters, crutch leg substitutes like an iWalk, wheelchairs, and even shower chairs are all devices that are often used after surgery. Someone from our team will perform an equipment assessment with you to determine which combination of walking aids and devices will be best for you. Paperwork for a temporary handicap placard will be provided to make getting around the community a little easier while your mobility is decreased. So time off of work. This is going to be variable depending on the procedure you have done and the type of work you do. In general, if your work is office-based or more sedentary, then you can typically return to work soonest 1 to 2 weeks from surgery using walking and mobility aids like the knee scooter, iWalk, or crutches if permitted at work. Jobs that are physically demanding or involve a lot more walking could likely take 6 to 12 weeks plus from surgery to return to full duty. If you have any FMLA or short-term disability paperwork that needs to be filled out, please forward that to our office. Postoperative medications. To manage pain, we use a multimodal approach after surgery. Depending on your procedure, you will likely have a nerve block that can last up to 18 to 24 hours after surgery, controlling pain. After the nerve block wears off, you will have various medications to manage post-op pain, including an opiate, such as oxycodone, Tylenol, an NSAID, such as ibuprofen. Gabapentin, a nerve medication, may be added for a short period of time after surgery if needed. My goal is that by 2 weeks from surgery, you're either off all opiate medication or in process of weaning down. And by 6 weeks, patients are off all opiate medications. To minimize the risks of a DVT or a blood clot, a full dose aspirin is recommended for 2 weeks after surgery. If you have a history of blood clots or an immediate family history of DVT or PE, and you have not discussed this already, please inform us because you will likely need to be on a prescription blood thinner for an extended period of time instead of the aspirin regimen that I mentioned. For any postoperative nausea, we will prescribe ondansetron to manage that. For any constipation secondary to the opiate, there are numerous over-the-counter options. However, if you would like a prescription medication, please let us know. And finally, we have been collecting patient-reported outcomes on various procedures that we do. These are surveys assessing your function, pain, and overall satisfaction before and after surgery. This data is then used by government health agencies, insurance providers, to help determine the effectiveness and value of the procedures that we do. So I'm very appreciative if you could fill those surveys out when they come to your phone or your laptop. Thank you.